For the first time since we started the Nation Leadership Forum, we are going virtual. These are not normal times. The world is dealing with a health emergency unlike anything we have seen in a century. We are dealing with a disease that is no respecter to age, religion, gender, nationality, or social status. Let me state the obvious. Coronavirus has changed our way of life. Despite the many disruptions, we are the Nation Media Group hope that you and your family are safe and well. Our hearts go out to those who have lost loved ones to this virus and wish a quick recovery to those who are sick. We also do recognize the bravery and courage of our frontline soldiers battling this disease to save lives. That is our doctors and nurses. Thank you so much for joining us tonight from around the country and those following this series of the Nation Leadership Forum together with our partners. You can follow this conversation on our social media platforms with the hashtag NMG Leadership Forum. And so tonight, we will look at how coronavirus has changed our lives. Now, joining us from different locations in the country, in our virtual panel, we have the Cabinet Secretary Trade and Industrialization, Betty Maina, who will help shape this discussion through the lens of government. From the United Nations, we have Siddharth Chatterjee, currently the resident coordinator, to help expand the development partners' perspective on coronavirus. A critical component in the fight against this disease is, of course, the emergency response. And Dr. Asha Mohammed, the Secretary General, Kenya Red Cross, joins us from our office and will help paint the picture of what is happening from a humanitarian standpoint. Jeremy Awori, the Managing Director, Absa Bank, will help us understand the impact of this virus on the private sector. And because this is in turn is affecting many homes, Dr. Stanley Mukolwe from Raising Future Parents will guide us through the impact of the virus on life and families and what kind of support is needed. So, ladies and gentlemen, welcome to this broadcast and to our panelists as well. And I will start off by just asking this very simple question. How has your life changed? And I'll throw this question to the entire panel, but I want us to start off with the CS Trade and Industrialization, Betty Maina. How has your life changed with this coronavirus pandemic?
Thank you very much. And thank you for putting this together. I think everybody's life has changed as a result of coronavirus. I definitely find myself, first, I think the issues around being careful in interactions with people, and especially the issues of social distance. It has become a very strange thing, but we no longer shake hands and you don't go close to people. So that's one. So no hugs, no shake hands, and no close proximity. I think the second thing that has happened is as a result of the measures, a lot of public places have closed. So we find that we're spending a lot more time with family, and especially in the context of the curfew. So that's actually a very pleasant thing, being able to spend more time at home. The third thing is being able to do this. We would have been in the studio or waiting to start for a long time in a joint location, but now we're able to do things more online. So it actually becomes a lot more efficient and much more pleasant.
Well, very many thanks, Betty. Indeed, life has changed. And I want to throw this also to the resident coordinator of United Nations. And allow me, sir, to call you Sid. How has coronavirus pandemic changed your way of life and your way of doing things?
Family, it has been a dramatic shift of life. First and foremost, we've started to work and telecommute in our work. But at the same time, we have a duty of responsibility to the most vulnerable in supporting the government to respond to this particular crisis. Don't forget that Kenya is also coming out from a protracted drought, followed by floods, followed by a locust invasion, which has kept the United Nations family extremely busy over the last 2-3 years. But now with the arrival of the COVID pandemic, it has really, put us on tenterhooks. But at the same time, while we are telecommuting, we have close to about 80 staff embedded with the government of Kenya to provide the necessary capacity and support to be able to respond to this crisis. It is perhaps an acid test of multilateralism, and I think that is what has changed quite substantially at this present moment.
Well, Sid, I realize both you and Betty are you're looking at the entire perspective of what this pandemic has done to the entire country and obviously globally. But just at a personal level, I will want to bring in the Secretary General of the Kenya Red Cross, Dr. Asha Mohammed. How has this at a personal level impacted your life?
Good evening, and thank you for that question. I just want to start by saying, yes, I'm a social animal, so for me, this has really changed my life, both at the workplace and at home. I normally like to interact very closely with colleagues and also at home with the family. And so this has been very difficult in order to be able to, of course, keep the physical distancing. So it has really been something new to change. Some of the work that we do, even as an individual, talking to people and counseling people, just the gesture of being able to give somebody a hug. I have always known that as something that can go a long way in reassuring someone. And it feels a bit strange now that I cannot even do that because I can only be able to speak to the person from a distance. And even a smile, I mean, I would like to keep smiling and encouraging people, but if I have to keep smiling behind my mask, I'm not sure they can see this smile. So it has affected even the way I do my job. It has affected my interaction with my family. In just the last few weeks, I have missed several occasions that we had planned for a very long time. So it has in a way turned my world a little bit to a different direction. But I must also say there are some positives as well that has come. For example, being able to think a little bit deeper into the kind of work we do because, we have to adapt to the current environment. Technology, I've had to use that much more in my work and still being able to keep in touch with the family and also colleagues at work.
Thank you so much, Dr. And Jeremy Awori, who's the Managing Director, Absa Bank. I just want to bring him in. Both Madam CS Betty Maina and Dr. Asha Mohammed have mentioned missing hugs. Are you also missing hugs?
I'm not able to hear.
This. Jeremy, can you hear me now?
I can hear you now.
Great. I earlier asked, I was asking you that Dr. Asha Mohammed, who's the Secretary General of Kenya Red Cross, and Madam CS Betty Maina say that they miss hugs and just the normal greetings. Do you miss the hugs as well? How's COVID-19 changed your life?
Yeah, I think like the other panelists have said, I think the human contact is everything. Where I'm quite social, Kenyans are social, and having to keep the distance from people is quite unusual. And I think it's quite difficult, frankly. I also enjoy, in the work context, we're a contact sport. We're interacting with colleagues, we're interacting with customers on a daily basis. And all of a sudden, that has now shifted to doing it virtually, doing it on the telephone. I find it a little bit challenging being on the phone the whole day, or using Zoom or WebEx to host meetings, because you miss a lot of the non-verbal cues when you're not seeing somebody in the same room when you're communicating with them. I think the other thing for me that's been both a positive and a negative is that travel has been completely cut down. I would travel a lot with my job, and because all the airports are closed, I guess that really shuts down that, which has a positive. You can spend more time with your family, and I do that. It allows you to exercise more, and it allows you to coordinate your work to suit your schedule. So there are pros and cons to this as we adjust.
Well, many thanks, Jeremy. Everyone is just trying to adapt to this current situation, and I want to bring in Dr. Stanley Mukole from Raising Future Parents. From the other three, we have to adapt to this current situation. And Okay, Jeremy Awori also talked about, missing that human feel in meetings and just interacting using technology and also spending more time with family. So, Dr. Stanley, are these some of the things that are such a huge concern? And for you personally, how has been your experience? How has COVID-19 changed your life?
At a personal level, I am having great fun. I'm a deep thinker and I need time to think and process information. I'm having a wonderful time with my wife. At a work level, addressing future parents, we rebuild families to strengthen nations. And so the families being back home together is putting us in a place where I've always wanted families to be. So this crisis is going to strengthen families, and I'm actually thrilled by that. Not by the crisis, but by the strengthening of families.
Well, an interesting perspective there. You are enjoying this. You're having a great time because obviously building families to strengthen society, like you've said, spending more time with children at home and with the spouses. Now that we are done with that part of the business, I just want to go straight into our main subject, how we are dealing with this coronavirus issue. And I want to start with the Trade and Industrialization Cabinet Secretary, Betty Minor. And the first question I want to ask you is, what is the impact of this virus on trade in the country and which sectors have been greatly affected at the moment?
Thank you. The impact of the coronavirus has been different. I think in the initial stages, the big concern was about disruption to supply chains, and especially for those who rely on imported goods from China. By the third week, the impact was more about the export side of things, with especially in Europe and America. Once the virus hit those countries and the health measures that were taken, including social distancing and closing out a lot of open spaces and markets, we saw a collapse in the market for flowers. We saw a collapse in the market for garments. Within the country, the impact once once we had the first COVID case in Kenya and the measures were announced from the 15th of March, and we've seen a lot of changes in the workplace, more teleworking and working from home, thinning workspaces, and also just the loss of some businesses. Now, the most affected sectors has been the hospitality sector. A lot of our eateries have had to close down. The second one has been our tourism. Our hotels have had to close down. The third, obviously, especially with the loss of air travel, has really affected international travel and related businesses. So we're starting to see different dimensions of impact on business. When we imposed our own measures, we've also seen an impact on cargo movement and mobility of goods, but that has been corrected. So there's been very widespread. Schools closed, so demand for local foods has also been affected once boarding schools are closed. So there's been everybody has been affected in business by this virus. Thank you.
Madam CS, still on this, many countries have come up with plans to cushion those people who've lost jobs. And in the country, like you've mentioned, out of all the sectors that have been affected, you've mentioned the hospitality industry, the tourism, air travel has been affected. And the key driving force to any economy is having, a workforce. And there are so many people who are going to lose their jobs because of the collapse of many of these industries. What is the Kenyan government doing through your ministry to cushion those people and the many who are going to either lose their jobs or rendered redundant?
I think many measures have been announced. I think the first measure that was announced was to try and increase the amount of money people had in their pockets for consumption through the reduction of VAT and through the reduction of PAYE. And that has had, obviously has an impact on people. The second thing has been the support to businesses through the measures from the banking sector, improvement of liquidity through the relaxation of the cash reserve ratios for banks. So we've taken some of those measures, but I think we continue to monitor the measures to see their impact. I think one of the things we've been quite concerned about is obviously the impact on small businesses, and that's why the support from the banks and the additional liquidity from the banks is going to help small businesses who are operational. But I think the way Corona has affected us, it has almost divided the economy in two segments. There is a component that we consider essential services that must be maintained, food and food delivery or essential delivery, cargo movement, essential services which must be maintained. But some elements have actually had to be suppressed. Hospitality and the eateries and social spaces have had to be suppressed as a part of managing the transmission level. Thankfully, these measures are seeming to have an effect for us. So at least there is a way in which we have avoided the onslaught that we saw in other countries that did not take the extreme measures that we have taken. A government has announced an enhancement of the cash transfer program for vulnerable families. The other one is also been a cash transfer for other vulnerable families and in low-income settlements and in rural areas. So taking steps to ensure that you can support the most vulnerable people is what government has done. The second thing that government has done is also turn to the domestic economy for sources of a lot of medical commodities. We have seen the increase in supplies of masks, supplies of PPEs. We're now working towards supplies of ventilators. So at least some demand has been created locally and utilization of excess capacity within our factories that have suffered depressed demand in the export markets. Then they've turned on to the domestic sources. The third thing that has been done is that as measures ease in Europe, we've seen an increasing demand for our vegetables, an increasing demand for our flowers, and now the utilization of excess capacity, for instance, in Kenya Airways to transport cargo to Europe. So that at least is at least we're trying our best to ensure that we can deliver, support our economy. But there's no doubt in our minds that there's still some sectors of business that are going to be hard hit by Corona, and I think and by the measures taken. But if we all comply with the measures that are...
Well, I think we seem to have lost Madam CS there in our last comment there, talking about how some businesses are going to be hard hit. And when we come back from this short break, I want to bring in Jeremy Awori to just give us some insights on what the banking sector is doing about this. But before we take that break, remember to join into the conversation. If you have questions or comments, the hashtag to use it at the hashtag is NMG Leadership Forum. The hashtag is NMG Leadership Forum. We'll be back after a short break.
Niaje wa Kenya. Hii ni public service announcement kuhusu coronavirus.
The Ministry of Health advises all returnees from abroad to self-quarantine for at least 14 days, whether they feel well or unwell.
Wash your hands regularly following the 8 steps of hand washing. Wet hands with warm water. Apply a small amount of soap. Rub palms together. Rub fingers and thumbs and the beads in between. Rub nails on palms. Rub the back of each hand. Rinse with clean running water and dry thoroughly with a clean dry towel.
Furthermore, it is advisable to cover your mouth and nose adequately when sneezing or coughing and immediately dispose of the tissue in a dustbin. Please do not use handkerchiefs if you can avoid it. If disposable tissue is unavailable, cough into your elbow. Try and avoid close contact with anyone showing signs of respiratory illness, such as coughing or sneezing.
Before you share any coronavirus information on social media, please verify it with Ministry of Health to avoid panic and alarm among your fellow Kenyans.
Oya ni aje, mimi Jonte Fresh. Mimi ndio nimetambulika hii Gikomba yote sekta ya manguo. Jumio transform nguo ordinary za mtush zenye ziuka mna hii harufu ya bail into the freshest igi kosi yote. Siri ni hii Real mpya ya pink. Na kushow mtush zinang'ara kung'ara kushinda kamera. So clean, so fresh. Ma customer unaisana na hii story. Ninatumia aerial touch-up down mpya tu.
I help women find independence by training them in fish farming. It's tough on my back, joints, and can cause headaches. Panadol Extra relieves multiple types of pain. Panadol Extra, now with new Optizorb technology to fight multiple tough pains with 3 times more pain-relieving medicine in the first 30 minutes when you need it most. Seeing them support themselves makes any pain worth it. If symptoms persist, seek medical advice.
Medical pay bills zero rated. Payable transaction fees removed at all national and county hospitals and clinics. Safaricom is for you.
Sensitivity is a short, sharp pain that people experience when they have something hot or cold getting to the nerve of the tooth, causing that discomfort. If the sensitivity is left alone, it may get worse. Dentists recommend Sensodyne to their patients. It's able to get inside the tooth and calm the nerve of the tooth down, and the proof's in the results. It works.
Nyaja wa Kenya, hii ni public service announcement kuhusu coronavirus.
The Ministry of Health advises all returnees from abroad to self-quarantine for at least 14 days, whether they feel well or unwell.
Wash your hands regularly following the 8 steps of hand washing. Wet hands with warm water. Apply a small amount of soap. Rub palms together. Rub fingers and thumbs and the bits in between. Rub nails on palms. Rub the back of each hand. Rinse with clean running water and dry thoroughly with a clean dry towel.
Furthermore, it is advisable to cover your mouth and nose adequately when sneezing or coughing and immediately dispose of the tissue in a dustbin. Please do not use handkerchiefs if you can avoid it. If disposable tissue is unavailable, cough into your elbow. Try and avoid close contact with anyone showing signs of respiratory illness, such as coughing or sneezing.
Before you share any coronavirus information on social media, please verify it with Ministry of Health to avoid panic and alarm among your fellow Kenyans.
Heaviness and a burning inside, it could be heartburn.
Kiungulia na kuvimbiwa? Ino inatibu ndani ya sekunde 6 na inatuliza dalili 6 za kiungulia. Kwa hivyo unaweza kuburudika bila kikomo. Ino tibu haraka kiungulia na tumbo kuvimba.
Welcome to this special series of Nation Leadership Forum. The hashtag to use in our conversation is the hashtag to use is NMG Leadership Forum. And with us in our virtual panel, we have the CS Trade and Industrialization, Betty Minor. We have UN Resident Coordinator, we call him SEED, and the Kenya Red Cross Society Secretary General, Dr. Asha Mohammed. Also joining us is Jeremy Awori, who's the Managing Director, Absa Bank. And last but not least, Dr. Stanley Mukolwe from Raising Future Parents. Earlier before the break, Madam Waziri was speaking about the impact of this and just responding to the questions on how the government is cushioning those people who will lose their jobs and some of the interventions. And the last statement, if I got her there, she was talking about how some businesses are going to be hit hard. And she also mentioned some of the interventions, including how they're engaging the banks. And I want to bring in Jeremy. Jeremy, in terms of cushioning Kenyans from the impact on the economy, what are the banks doing following the government's directive?
Yeah, I mean, I think from a bank perspective, there are 2 specific areas that we're focusing in on. One is our colleagues and our staff. We have a duty of care to keep them safe. as we manage through this crisis. And there are many initiatives that we've taken to make sure that that happens and that they are following the directives of the government and personal hygiene, with a view to just making sure we create a safe working environment for them, and in turn also create a safe environment for our customers to also come and do business with us. So as an essential service, one of the things we've got to do in such a situation, in my opinion, is we have to rally around Kenyans and we have to rally around customers. This is something which is affecting not just Kenya, Africa, it's a global pandemic. Now is the time when we really have to be creative and think through solutions that will support businesses to remain open, because those businesses affect the livelihoods of Kenyans through either employment, paying their salaries, and we've got obviously our personal customers who may have taken facilities and are repaying loans and now finding it more difficult to make those loan repayments. So the banks have tried to do a number of things. One, you'll have seen banks giving customers loan repayment holidays that vary in time. So basically you get a bit more time to pay off your loan for the next few months. And that eases your cash flow situation. In certain instances, there are moratoriums that we give. And then for the business customers and the corporate customers, we look in specific circumstances and see how we can restructure your payment. So if you look at the floriculture business, they found the markets closed down, when the auctions closed, in Holland. It would be unreasonable, given they're not actually able to sell their product, to expect them to make loan payments. So we've specifically restructured. Same thing for the tourism and hotel business. Coming to an understanding around ways that we can support them, I think, is very critical. I think the improvement and the reduction in the cash reserve ratio by the central bank has helped to make sure that the banks have the liquidity to be able to support their customers. And there are a number of things we as a bank also, as ABSA, have made sure we're trying to do even more by making sure we pay our bills as quickly as possible. And I urge the large corporates with suppliers who are SMEs to really quickly pay those bills, because that cash flow can make a significant difference to the cash flow and the operation of their respective businesses. So I think the thing is, we need to work as industry, and as the banking sector, you will also see a number of announcements around what we can do to support the government to fight this coronavirus. And we're working with the Ministry of Health, as well as the Treasury and Ministry of Interior, to also play our part above and beyond our role in the banking industry itself to provide banking services. Last but not least, we also would like to encourage customers not to use physical cash. We're encouraging the use of digital and mobile money, and I think Kenya is definitely a leader here with the likes of M-Pesa and the ability to move money between bank accounts and M-Pesa and vice versa. And we're doing this at no charge to try and again alleviate some of the costs that the Kenyan public are facing through this difficult period.
I mean, Jeremy, some of the SMEs and many businesses, despite this government's directive, are still struggling due to this pandemic, and so many are servicing their loans. Is there a workable arrangement that can relax in terms of payments if the current arrangement does not work? Are the banks willing to look into what else you guys can do to just help those Kenyans who will be struggling in loan repayments?
Yeah, I mean, I think we need to remember that this really landed on our doorstep roughly a month ago when we started seeing that it was going to impact Kenya and Kenyans. So the response was quite rapid. I think we're going to have to be agile, and we're going to have to see, depending on how this evolves, what else we can be able to do. So, as I say, by giving loan holidays, at least it means that you're not having to make a loan repayment during this next, say, maybe 3 months or 6 months. But I think what we can start looking forward to is to try and see if we can partner, maybe with the government, maybe with other financial institutions, to guarantee some of the loans to support businesses through this, through this difficult period. So it's going to require all the best brains in different industries to work together to tell us how we can do it, because this is extremely difficult for businesses to weather this storm, and we must come together to support one another.
Well, difficult times there. We'll go back to Trade CS, Betty Minor, to just give us a glimpse of what the economy is going to look like in light of all this. But I want to bring in Siddharth Chatterjee. Let me call you Sid, the UN Resident Coordinator. Sid, today the Health CS, Mutai Kagwe, said it is an issue of concern that the US President Donald Trump directed his administration to halt funding to WHO, saying it failed to take action when it received credible information of a potentially pandemic problem in Wuhan, China. First, is this true? And secondly, what will be the impact of the US freezing their funding when countries like Kenya have, to some degree, heavily dependent on what comes from WHO and the other UN subsidiaries?
So, Dennis, let me start by saying that WHO, the World Health Organization, is doing outstanding work in responding to this particular pandemic. In fact, their staff, their volunteers, their leadership have really been on the front line. And I really commend Dr. Tedros, the Director General of WHO, who's really been at the forefront leading the operation. Frankly, this is not the time, as the UN Secretary General has said, to start looking at what happened, what didn't happen. What we now need to do, as the Secretary General constantly reminds us, is this is an all of society, all of government, everyone is in play to defeat and flatten this curve. So right now is not the time to cut any funding. It is right now to galvanize, come together. And the leadership of the United States is absolutely critical, being the biggest funder to WHO and to the United Nations system, to the whole spirit of multilateralism. So I think the Secretary General has spoken on this quite clearly. But let me also point out that the Minister of Health in Kenya, Mutai Kagwe, was recently commented upon by the Wall Street Journal for the kind of leadership Kenya is giving. And I must commend the government of Kenya for really having been on the front foot in dealing with this particular pandemic. In fact, their ability to move forward and galvanize society has been quite remarkable. And as the United Nations family over here, like I said earlier, we are in lockstep in that response. And right now, it is a collective response which will matter, not about singling out any organization about its ability. Over to you, Dennis.
Sid, how has this pandemic then affected and impacted on UN operations in Kenya and also globally? Because politics is coming into play, and clearly the UN has to see a way of dealing with this. So how have you been affected in terms of your operations on the ground?
So the United Nations family in Kenya, actually together with the government of Kenya, has already done what we call a redeployment of our resources from within the UN Development Assistance Framework to Kenya, which is from 2018 to 2022. So under the leadership of CS Treasury and CS Devolution, CS Yatani and CS Eugene Vamalwa, we've redeployed about $45 million US dollars towards Kenya's COVID response. Above and above that was last Thursday, the 9th of April, the United Nations, together with the government of Kenya, together with about 30 international and national non-governmental organizations, which includes the Kenya Red Cross, launched a global flash appeal for about $267.5 million. And this flash appeal, Dennis, is really meant for the 10 million people that are living at the periphery, at the margins, in the informal settlements, the orphans and vulnerable children, the refugees and forced migrants. These are people that we are concerned about. These are people that the government of Kenya is concerned about. So what we are trying to do is position our staff to be able to support the government, both here at the national level and at the county level. But what we've done is really come together. And this particular pandemic has brought the entire UN family, the development partners, and as I said, I commend the government for its leadership. But above and everything else is the private sector and civil society organizations, the important role the media is playing. So I'm quite fascinated, and I think that Kenya perhaps not only will flatten the curve, but I feel confident that Kenya may set a blueprint of how to fight future pandemics. I hope so. Over to you, Dennis.
Thank you, Sid. And I think it's the right time to bring in Dr. Asha Mohammed from the Kenya Red Cross, Secretary General. Karibu sana. And what Sid has just said, as one of the partners and involved in trying to flatten the curve on this global pandemic, I understand you have a disaster management department. Ideally, I'm assuming this is about monitoring response and preparedness to disasters that include terror attacks, accidents, buildings collapsing, and obviously a pandemic like this one. Since you work with communities, what did you do in terms of monitoring before the first announcement of COVID-19 into the country, and what are you currently doing?
Thank you very much, Dennis. For the Kenya Red Cross Society, as you say, we are working very closely at community level. We are a grassroots organization present in all the 47 counties with 160,000 members and volunteers. So before the first reported case in Kenya, we had already started looking at different scenarios. Right from January, our disaster department led the rest of the team into a process of planning, contingency planning. I think we are talking about, yes, COVID-19, but let's not also forget that Kenya is also at risk of other disasters. So we were also looking at the floods because we know the weatherman had already started to give us indications that, yes, the rains might continue and they might continue to be heavy. We had the locust issue that had already started. So we had to look at all these different scenarios, and also in the context of COVID, what does that mean? So we already started working on a contingency plan, looking at the different scenarios, pre-positioning some of the items that could be needed, but more importantly, training of our staff and volunteers. Actually, we started training trainers of trainees, and the last batch was actually was finishing their training on the day that there was the first announcement. So we were well prepared, I would say, at that point, and thanks to the support of the UN and other partners, our Red Cross movement partners, who have been working with us all along to be able to do this. At this point in time, in terms of the response, we are very much at community level, continuing with community sensitization, ensuring that actually those in very hard to reach areas, I think like Sid mentioned, the refugee population, we are talking about the informal settlement, but we also have other groups, for example, people with disability. We are working now closely with, to see that street families also get the information and maybe even the food that is required at this point in time. One of our big activities as well in support of the government and as co-chair of one of the subcommittees is actually psychosocial support. So we have been involved in a lot of activities, counseling healthcare workers, counseling those that have tested positive, their families, those in quarantine. But more importantly, we have a toll-free line, 1199, that has been up and running, where people can call and actually receive counseling. And this is not only limited to COVID issues, but also to other problems that they may be encountering. And I would like to say that we have seen, as the minister said earlier today as well, that some of the calls we are getting are actually people who are calling in to report about domestic violence. So these are some of the activities we're doing. We are also looking at prisons. We are working closely with the prison authorities, with the support of our partners, the International Committee of the Red Cross, to ensure, yes, that the information also gets to the prisons, but more importantly, to ensure that they have actually the facilities that they need to be able to prevent the spread. So distribution of hand washing facilities, soap and sanitizers, and masks, these are the things that we are distributing. But I would also say that we also run health facilities, especially in the refugee camps. So we have ensured that our staff, as healthcare workers, also have the necessary PPEs to ensure that they can also continue to take care of the patients while they ensure that they also do not put themselves at risk, but also do not put the other patients at risk.
I'm back to you on that. The question then will be how, out of all that you've mentioned, and we'll look at stigma. But I want to now bring in Dr. Stanley Mukolwe. In light of all these, families are involved and families are indeed affected. And on 6th of April, and I want to quote what UN Chief Antonio Guterres pushed for, measures to address what he called a horrifying global surge in domestic violence directed towards women and girls. And today, Health CS Mutai Kagwe also called on religious leaders to actually weigh in and counsel against an emerging trend in the country. What exactly is happening globally, and to be specific, within the Kenyan context, Daktari? Okay, we apologize for that. I think we'll get back to Daktari, but let me bring in Dr. Asha Mohammed one more time. You mentioned the areas that you're involved in and offering counseling to those groups. There is stigma around this virus. Lately, cyberbullying has also come into play. And I'm saying this with reference to the recovery of cases that were made public recently. What are you doing to those who are sick and those who have recovered, those in isolation or under quarantine and their families? How are you doing it, these counseling sessions? Do they come to you or do you go to them?
Thank you, Dennis. Yes, thank you, Dennis, for that question. We employ different methods. For example, yes, there are those that will call us up because the 1199 line is well publicized and they know how they can reach us. But we also reach out proactively. For example, even with the healthcare workers, we have been able to have virtual counseling sessions with some of the healthcare workers. We have also done some trainings to some of them so that they now continue to actually give peer-to-peer support to their colleagues. But also more importantly, for example, with the quarantine centers, we had counselors actually stationed in 21 of the quarantine centers where they are able to continuously give that support. We also follow up with families of those that have been affected, whether in quarantine or in isolation centers, and continue to give the counseling. I think the question of stigma is an important one, and it's good that you also raise this, because this is becoming a big issue, which we really need to also deal with, because it can actually impact on the response. For example, with the issue of stigma, it means that there are people actually who could stay away from reaching out and, trying to seek help. And therefore, it's something we need to deal with. So what we are doing, we are integrating this in our messaging. We are integrating this in our sensitization program to ensure that even as we tell people about the facts and the correct information about COVID-19, we also take the opportunity to have some anti-stigma campaigns to ensure that families and communities understand what it means and the fact that we can all be affected in one way or the other, and therefore there is no need to stigmatize anyone. So this has to go hand in hand with all the interventions we are doing. Like I said, yes, this is becoming an issue. I think even for us as first responders, we have seen, yes, situations where this has become an issue where, people are not sure, they'll say, oh, maybe you will be the source maybe of the infection because you're always out there. I mean, some of us colleagues have also been able to see some of this coming up in families where when you go home as a first responder, your family is like, we hope you're not the one who's bringing us this infection because we are all at home and you're the one who is going in the front line. So this stigma is real, and it's important that, yes, we do something about it and really make sure that this message goes out to every Kenyan that this is something that can affect anyone, and therefore we need to be there and to support each other.
Well, thank you so much, Dr. Asha. I think we'll now move to donations much later on. Let me bring in Trade CS Betty Minor. If you can hear me, my question then would be is the speed at which we have seen, Kenyatta University students develop ventilators to help in the fight against coronavirus. We're talking about Kitui Textile Factory, which plugged in to produce face masks, including EPZ doing the same. We have many young people who have also come up with applications and technology and innovations to help fight this virus. There is an argument that we have local capacity for manufacturing in Kenya, but we lack political goodwill and support from the government. When will we stop relying heavily on imports and embrace homegrown solutions? CS.
Thank you very much. And sorry, we got cut off. I think the time for the call had ended before we finished our conversation, but I'm glad I'm able to get back. I think the issue about innovations is that this is a country that has a lot of innovations, and there are some things that we're really extremely proud of, like M-Pesa and others. I think this COVID challenge has also given us an opportunity to rediscover some of our own innovativeness, which should be celebrated going forward. The government is a large consumer of goods, but it is also not the only one. I think all of us are consumers of goods. Sorry, excuse me.
Oh, we seem to have lost Betty Miner there again. I think she's back. Let's just listen to
a bit of a cough, huh? So I think what we're saying is that we all need to value our Kenyan products. We all need to value our Kenyan innovations. And I think this is a good opportunity to celebrate them. And so far, we've had more than 20 companies come up to produce PPEs, which is very exciting. And I'm certain going forward, not only will we produce for Kenya, but we'll also produce for other countries. Thank you.
Well, thank you very much, Madam CS. I think at this point we'll take a break. We'll come back with our panelists. Remember the hashtag to use is NMG Leadership Forum to just keep up with the conversations, your comments as well. And just to bring in some good news, despite all that's going on, Nation Media Group is constantly looking for new and innovative solutions to improve your experience across all our different platforms. And we are proud that we're presenting a new and improved Nation e-paper platform during this time and going forward. So the publications that you previously have been enjoying and accessing in separate formats, that's the e-paper platform, has since changed. And with the launch of this new Nation e-paper platform, all NMG e-paper publications, that's your favorite one, the Daily Nation, the Business Daily, the East African, and Taifa Leo can all be accessed in one platform, and this change is going to aid in delivery of a superior and more user-friendly and creating more products that are relevant and timely just for you anywhere and anytime. You can subscribe, make sure you subscribe, and currently there is a promotion that is running which is going to enable you to get free access to Daily Nation and the Business Daily newspaper and the Taifa Leo e-paper up until 20th of April this year, 2020. So you still have 5 more days to go around this. We take a short break. Nation Leadership Forum will be back.
Shawa na sawa, inakawia bana, inakawia shawa ni sawa, wazi yangu iko sawa, ninanukia vifiti shawa ni sawa, rangi ya kupendeza bei iko poa ching 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 shawa ni sawa, usisle kibana wetu mia saa ushinde sawa all day. Sour Shower has never been better with the new look Sour. Now with a new formulation too that will leave you feeling fresh for longer, while the soap lasts even longer. For a better tomorrow, don't forget to do the 1, 2, 3 with Colgate every night.
discovered the world-famous Molfix and saw the difference. Let's see how absorbent Molfix is. Molfix, thanks to its ultra-absorbent particles, can keep more liquid than the other diaper brand, so you can use it comfortably all day long. All babies deserve a high-quality diaper. You should also try Molfix.
Disinfect and protect your home with Jik. Jik kills 99.9% of illness-causing germs. Disinfect floors, kitchen and bathroom surfaces and wash white clothes, towels and dishcloths with Jik bleach. Just Jik it.
Selena!
Toto, where's mommy?
Today's a toilet day.
What? Oh.
Selena!
Toilet day?
Tomorrow we're hosting a party and it's a matter of my reputation.
It's a toilet, not a white shirt. Even if you spend your entire day cleaning with bleach and detergent, still won't be party ready.
Impossible.
Challenge. Harpic 10X. Even if you use bleach and detergent 10 times, they won't give you the same sparkling clean toilet that Harpic 10X will give you.
Wow!
Harpic 10X. Harpic, Kenya's #1 toilet cleaner.
Ni aje, mimi ndo Jonte Fresh. Mimi ndio nimetambulika hii Gikomba yote sekta ya manguo. Jumio transform nguo ordinary za mtush zenye ziuka mna hii harufu ya bail into the freshest igi kosi yote. Siri ni hii Ariel mpya ya pink. Na kusho mtush zinang'ara kung'ara kushinda kamera. So clean, so fresh. Ma customer unaisana na hii story. Ninatumia Ariel touch of down mpya tu.
Kira! Kira? Where are you?
Valeria!
That's why you need the superior protection of Mortein 360-degree reach. Only this has 11 fans which enable it to reach the farthest corners. Mortein, total indoor protection.
Kazi ni simu, isn't it? Umeona ring yangu?
Ring gani?
Ni za gold, pure gold. Si zile vitu za 20 bob zenye mnanuanga huko.
Madam sijaiba kitu yote maisha yangu.
Oh, so umeanza wizi hapa kwangu Nataka kuangalia bagi yako.
Sijachukua kitu yote madam.
Vitu zinapotea kwa nyumba, kwa hivyo ni muhimu tukiangalia kama watu wanaiba.
Anachikile shop iko pale via M-Pesa, karibu na kwa Rasta. Ndio shop atatuchapulia usiku.
Hizi ni nini sasa?
Every day, we endeavor to provide you with the best real estate solutions. Own your dream home at Victory Gardens. Call us today on 0790 300 300.
This is NTV.
Tonight, fresh concerns of community infection as 9 more test positive for the coronavirus.
None of them has a history of travel, and none of them was in a quarantine center.
Also tonight,
we are not out of danger.
The counties dance with death as government takes the war against the virus to their doorstep. Plus, the healthcare warriors in the front line push on.
A lot of anxiety, a lot of panic, not knowing what to do.
On team coverage tonight, we put faces to the numbers, tell you of the battles won and lost as we count the cost of the pandemic. And also tonight, 10,000 shillings for one of these. Bungoma governor is washing his hands off it, but county documents show it's quite a stubborn stain.
Avoid the crowds and use your card. Pay with your Absa debit card at any point of sale. Or better yet, shop online. Stay safe.
Disinfect and protect your home with Jek. Jek kills 99.9% of illness-causing germs. Disinfect floors, kitchen and bathroom surfaces, and wash white clothes, towels, and dishcloths with Jek bleach. Just Jek it.
Discovered the world-famous Molfix and saw the difference. Let's see how absorbent Molfix is. Molfix, thanks to its ultra-absorbent particles, can keep more liquid than the other diaper brand, so you can use it comfortably all day long. All babies deserve a high-quality diaper. You should also try Molfix.
Here you go. Okay, thank you. Hi there. Selena, it's great seeing you getting so much value for your money.
Well, it's important to save as much as you can.
You save everywhere. Except for here. This is where you're throwing money down the drain.
How?
On these cleaning products.
Impossible.
Harpic 10X. While other cleaners flow away, Harpic 10X's viscous formula in only one round of application gives you sparkling, clean toilet. Harpic, 10 times better cleaning than other cleaning products.
And great savings too.
Disinfect and protect your home with Jek. Jek kills 99.9% of illness-causing germs. Disinfect floors, kitchen and bathroom surfaces, and wash white clothes, towels, and dishcloths with Jek bleach. Just Jek it.
When you're facing stubborn stains, you're always in a fierce fight, especially when others are fleeing away. However, with Cleesoft, I can make it so easy.
Cleesoft iko na 3 times particle energy to particles to blue husaidia kutoa mastain ngumu ngumu na ina enzymes za kulinda nguo zako ndio ziachwe zikikaa fresh.
Cleesoft kicks out stains kimateki.
Serious?
Look how happy my baby is. I tried different brands, but now I've discovered the world-famous Molfix and saw the difference. Let's see how absorbent Molfix is. Molfix, thanks to its ultra-absorbent particles, can keep more liquid than the other diaper brand, so you can use it comfortably all day long. All babies deserve a high-quality diaper. You should also try Molfix.
Birthday party.
Birthday party. Birthday party. Are we not invited? Malaria.
Mommy, best!
Rat.
Oh, die.
Party.
Compared to ordinary spray, Mortein Dew and Power Guard kills disease-causing pests instantly. Mortein Dew and Power Guard.
Hamujambo wanafunzi wezagu, lesson yetu ya leo tunaongelelea kuhusu COVID-19. Rule number 1, osha mikono na sabuni na maji. Rule number 2, usiguse uso yako. Rule number 3, ukisikia unataka kukohoa, si ni Rule number 4, corona haibagui mtu yoyote. Tukomeshe corona.
Welcome to this special edition of Nation Leadership Forum. And our focus tonight has been how coronavirus has changed our lives. There are 4 panelists with me, and thank you so much for your patience after that long break. I have CS Trade and Industrialization, Betty Minor. We also have UN Resident Coordinator, Colin Seed. And the Kenya Red Cross Secretary General, Dr. Asha Mohammed. Also with us is Jeremy Awori, who's the Managing Director, Absa Bank, and Dr. Stanley Mukolwe from Raising Future Parents. And Dr. Stanley, if you can hear me, I earlier asked you before you went off. On 6th of April, UN Chief Antonio Guterres pushed for measures to address what he called a horrifying global surge in domestic violence directed towards women and girls. And today, the Health CS Mutai Kagwe has also called on religious leaders to weigh in and counsel against an emerging trend in the country of domestic violence. What exactly is happening globally and within the Kenyan context regarding this?
The shutdown has increased the interaction between people in homes. Many parents are stressed because of low income and the prospect of job loss. And, like a majority of Kenyan families are really quite dysfunctional. Men come home late when kids have gone to bed, but now men are coming home early and don't know what to do. Some of the people are stressed because of low income, high food budget, and all the challenges that people face in their personal lives are becoming evident. I think in our own country, we had a situation where a woman was abducted and abused sexually in a particular house, and was only rescued when the neighbors came to her rescue. So the incidents of abuse are going to increase unless there's intervention. But on the other hand, families that have always wanted to spend time together, families that have been trained on what to do together, are having a wonderful time of interaction. Fathers are participating in chores in the home. House helps have been let out, and for the first time, families are appreciating the role that house helps play. And in some houses, the house is too crowded because there are children everywhere. In some situations, the food budget has gone up significantly because children were eating at school, and now they're having all meals plus snacks in the home. So the combination of the family stress, not knowing what to do, low income, and many people used to escape into bars and spend time with friends. Now the cracks in people's lives have been revealed, and this will lead to an increase in observation of mental illness as people are confined in spaces. It will lead to an increase in domestic violence. But when life is tested, it's only that which matters that remains. And if you are to speak to 20 to 40-year-old right now and ask them, what do you hope to achieve in the next 10 years? They will talk to you about their career path and their investment. But if you are to ask them, what do you want to see when you're 90 years old? They'll talk about functional relationships. This is the time to re-examine our relationships, because true success is not measured only in monetary terms. True success is measured in relationships. And this confinement is testing the convictions of people. The reset button has been pressed, and what's important is being revealed. When all is said and done, life is measured in relationships, and everything else is details. And the family relationships are the most critical.
Well, thank you. Thank you so much, Dr. Ari. Now I want to bring in Trade CS Betty Minor as we are concluding this. The tax laws, Madam CS, Amendment Bill proposes to reduce investment allowance for industries setting up in towns other than Nairobi. And this has been viewed as a potential blow to the manufacturing sector, especially at this time when many are still trying to stay afloat. What's the government's game plan here in just like a minute? What's the game plan here?
Okay, thank you. I think the issues about the tax laws, there has been concern for a long time about all the exemptions that have been given, and first of all, administering them and the results from them. So one of the things that this tax laws legislation was really trying to do was to tidy up tax administration by reduction of many of these exemptions. That's not the only one that has been proposed for reduction. I think the challenge that we are all facing is that it has also come at a time when we are also doing a lot to try and support businesses during this difficult time. But the big issue is that a lot of these exemptions have not borne the necessary investments, and they become very, very difficult to administer. And it was time to revisit all of them. But in my view, a lot of the assistance the government has given to business is really been a shot in the right direction and should support them to be able to tide over the negative or the hard part of dealing with corona. Because of course we know corona will not always be with us. There's life after corona, and I think right now many businesses are turning towards the recovery phase and to see the opportunities that this presents for them.
Thank you so much, Madam CS. I also understand you have another engagement, so we have to release you right now, but many thanks for your contribution on the panel. We will definitely have many more conversations. It's not just the last one. This is just the first one. Thank you so much, Madam CS. And I want to bring in Siddharth Chatterjee, UN Resident Coordinator, as we conclude this. And we're looking at Kenya, which is a developing country and with serious resource shortcomings, Sid. How does a nation like ours tackle a pandemic of this magnitude, and how is the UN in effect helping the government to this end?
Dennis, like I said at the very beginning, the UN is in lockstep with the government of Kenya. Just to summarize, $45 million have already been redeployed from our existing UN Development Assistance Framework. We've launched a flash appeal for another $267.5 million to support the government of Kenya. Having said that, recently Kenya featured in the Washington Post about one of its companies where the governor's charity, Ngulu, has started, retooled itself and started manufacturing gloves and masks and all that. I see this perhaps also as an opportunity of retooling, redefining our industry. And this is precisely the conversation we are having with CS Betty Maina, together with the European Union, the United Nations family led by UNDP, we are working with the World Bank and looking at possibilities of how we could actually be equipping and providing the technical knowledge as per WHO standards to produce some of these equipment, PPEs, gloves, masks, ventilators, which are currently in very, very short supply. In fact, the UN has been struggling to bring in test kits simply because there is no market in Europe and the US, for example, for these test kits because of an oversized demand. So is it possible for Kenya to become a manufacturer of these products? Absolutely. It will probably open up new opportunities of employment and become a hub for the healthcare industry. Keep in mind, Dennis, in the next 10 years, the healthcare business in Africa is going to grow to about $300 billion. But what this pandemic has shown us is that we need to be equipped for the next one. And that equipping will happen with the retooling of industry and the entire value chain that accompanies it. So I see this, while we are confronted by a global pandemic, the scourge, the velocity, the invisibility and the rage of this particular virus, as a human society, we will weather it. The science, the technology, the vaccines will come in place. But what it does is give us an opportunity now to pause, to look at what the new business construct is going to look like. And frankly, I feel a sense of optimism that Kenya would perhaps lead the way. Over to you.
Thank you very much, Sid. A sense of optimism there. And just to conclude this, I want to now rush quickly to Jeremy Awori, MD, Absa Bank. And Jeremy, you are a member of the Kenya COVID-19 Fund. And what are the fund's areas of focus, and how much has the fund collected so far, and what should Kenyans expect from the fund? I know it's a mouthful of a question, but very quickly, how will you answer that?
Yeah, the fund, first and foremost, has been working very closely with the government and the different ministries, first to understand what the needs are, and also to understand how quickly we can tool up for those needs. So the first thing that the fund has been doing is talking to corporates to get donations, and you'll have seen quite a number of donations being put in, and there'll be an announcement tomorrow in terms of how much has been collected via those commitments. What we can say is that we're encouraging all corporates, all individuals, to put money into the bank account and the pay bill number to basically equip the private sector to be able to fund some of these initiatives. There are two key priorities. We're looking at healthcare and medical equipment, and then also livelihoods. How do we take care of Kenyans who are suffering the economic effects of COVID? And they're going to be announced very specific plans around how we tackle those two specific agendas, and you'll be hearing a lot more about that in the coming days. What I can reassure Kenyans is that we're working with very credible partners with a lot of experience. There's going to be very good governance and transparency. We're working with PwC, Ernst & Young, Deloitte, among others. The board is extremely committed and is putting in place processes and capabilities, because this may be something which is not with us just for a few weeks. It may be with us for a few months. And then we will work towards other priorities in terms of how do we come out of this and encourage business to come out stronger at the end of this crisis.
Well, thank you very much, Jeremy. We look forward to that announcement, and hopefully we'll get something really good out of it. And I just want to conclude this with Dr. Asha Mohammed from the Kenya Red Cross. The state banned direct food distribution after chaos in Kibra just recently. How is the Kenya Red Cross supporting vulnerable families, especially in the informal settlements, and how are you ensuring that there is safety for your staff and for those you're trying to reach out? And do you prefer food donations or money transfers? Very, very quickly, we're pressed with time, Dr. Asha.
Okay. Thank you. Maybe just to say that I think for us, it's clear that the directive from government was not to stop food distribution, but it's about coordination and accountability. As the Kenya Red Cross, we work very closely with the national government, so with the DCCs and the different sub-locations, but also in the other counties where we are part of the committees that are led by the county governors. So we are working closely with government and following those structures. So we continue to do food distribution, but ensuring that, yes, the information, the data is actually reaching those that are coordinating this response. Yes, I think for us, we can say we are looking at both modes of aid, that is cash transfer and food distribution. We prefer at this point in time, because we believe we still have some markets, we still have some resources out there that as much as possible, if families get cash, they will be able to choose and to buy what they need. And later on, if this becomes a problem, then actual food distribution can be done. But it does not mean that we do not do food distribution, because we know there are certain situations, for example, children homes, homes for elderly, and those kind of target groups that will still need a direct food distribution.
Thank you so much, Dr. Asha. And just finally, Dr. Stanley Mukole, we don't have a lot of time. It's looking gloomy, and the country is really waiting to see if there's going to be a glimmer of hope. In a sentence, what is it that you can tell Kenyans as your final words?
Strong families to save this nation. In a time of crisis, people retreat their families, and weak families will not take the nation very far. So we need to invest in building families to have a strong nation.
To end it, building families, building the future of our country. Thank you so much. That's just one of the many conversations we will be having here at Nation Media Group. That was our special edition of the NMG Leadership Forum. The conversation still goes on our social media platforms. Tonight, we were discussing how coronavirus has affected and changed our lives. And we had the CS Trade and Industrialization, Betty Minor, UN Resident Coordinator, Siddharth Chatterjee. The name is such a mouthful, but I call him Sid. We also have the Kenya Red Cross Secretary General, Dr. Asha Mohammed, and Jeremy Awori is the Managing Director, Absa Bank, and Dr. Stanley Mukole from Raising Future Parents. I want to say thank you for watching. Keep yourself safe with your family and your loved ones. Just be safe. Have a good night. See you for the next edition of the Nation Leadership Forum.